Okay, I'll share with you some stories first. The various speakers have explained all the broad ideas and systems and putting a framework to it. So I'm going to give you the scenes on the ground. Okay, in October, a woman aged 60 had a very bad flu and it triggered her asthma, triggered asthma attacks and she couldn't breathe. So the blood pressure was high, oxygen level low, and she was given emergency treatment at a university hospital and was admitted. And expectorant and cough medicine were out of stock then. And medical staff have to go hunting for the medicine from another ward. But apparently, it seems like they couldn't find more medicine. So the patient was told to buy from the pharmacy outside. So can you imagine you're sick and you cannot go out? So she called a friend, and the friend after work went to the pharmacy, but the pharmacy was closed. So meanwhile, the patient is suffering. She's coughing and she's okay. At least she's getting some oxygen, but it's a lot of discomfort for her. And meanwhile, because of the medicine that's out of stock, the medical workers also face constant frustration. Okay, so and this is to show we don't really know whether this is because of a lack of funding or because of poor policy making, or the hospital didn't order in advance early enough. But I suspect it could be because of the lack of funding. So I've been hearing a lot of these things happening. And for moving further on, you see like some medicine and treatments are not provided for in the health ministry formulary listing. Some treatments were very expensive, and patients, if they want those treatment, they have to buy them from a private hospital. Okay, and the stories from patients, they couldn't get some of these expensive treatment in public hospitals. So if they have some funds, they will exhaust their insurance and savings to buy them from the private hospitals. So those who don't have money, your life just ends there, you know. And so I've written this article in 2018, an article about doctors in public hospitals not treating late stage cancer patients for the lack of medicine. Because of the lack of funds, sometimes certain medicines, especially like targeted therapies, they are very expensive. So it will depend on the funds that we have, like how much of these treatments can be supplied to the patients. So of course the priority goes to the younger patients who are better off at getting well. So the older you are, maybe your waiting line is longer. So but patients, even in with some of these late stage cancer patients, they want this treatment. They don't want just a palliative care sort of treatment. In public hospitals, they claim that the doctors just tell them, just take morphine and just basically tell them to accept their fate, wait to die lah. But some of these patients, they feel that because there are still treatments available, they want these treatments, but because of the lack of funding, they cannot get it. And it makes a difference because one patient says she could walk and work after treatment, even though it didn't cure her. Another patient says she could see her son graduate, and some even survive for 4 years, 8 years. Fourth stage, okay, fourth stage cancer. One patient said she had avoided a backbone or hip fracture. And she said, I'm also able to walk and do housework. That matters a lot because a lot of late stage cancer patients tend to be in bed, and they can't go around, they can't walk, they can't do anything. They're bedridden. They can't do anything for themselves. They need nursing care. But with this medicine, patients are able to take care of themselves. So that's the difference between having funds and not having funds. It's all about funds. And the other issue is bed shortage, of course. And in Taiping Hospital recently, this special officer to Deputy Prime Minister Neo Chu Seong, on his Facebook, his video revealed that emergency department in Taiping Hospital They have like canvas beds because the normal beds were already fully occupied. And this is in ICU, I think. If the canvas beds were filled up, the patients were to put on the chairs or lie on the floor while waiting for admissions. So even if they were to do resuscitations, they'll be on the floor. So you can imagine how dire the situation is now in the public, setting. Health Minister Zulkifli Ahmad visited the hospital last month. He said it was a temporary ward. The upgrading work on the existing ward would be ready this month. But really, public hospitals do face this sort of severe bed shortages, and more prominently during outbreaks such as the seasonal flu or during dengue fever season. Temporary beds were put out at the corridors and every space possible. You can try and visit these hospitals once in a while during this time. And, name it Hospital Tunku Ampar, Rahimah Klang, Hospital KL, University Malaya Medical Center, Penang Hospital, Ipoh Hospital, they all face similar situation. So, and not only that, like what have been shared just now, there's specialist shortage, and I wrote this story. I managed to get some stories from the doctors at that time. Doctors were not very willing to talk to the press, especially if they are government servants. So at that time, an oncologist I managed to contact one oncologist to give me a rundown of how severe, how deprived people are, especially the poorer ones, B40, how deprived they are, and how many oncologists we have in the country. So she gave me the breakdown in every state, and apparently in some states that state hospitals there are no in-house oncologists, and the hospitals with oncologists will have to serve several surrounding states. So can you imagine one oncologist have to do so much work, cover so many areas, and and if they don't have oncologists in that state, the medical officers there or the specialists in smaller hospitals, they will email the oncologist to prescribe the needed cancer treatment for patients. So that's really sad. That shows the inequitable, care that we get. You have money, you get to see an oncologist. You don't have money, you don't get to see an oncologist. So the delay in diagnosis and treatment is a serious concern. They determine patient survival rate. According to former Cancer Research Institute Director, Professor Dr. Noor Aisha Muhammad Taib, sorry. So 6 years later, Code Blue reported similar issues, and the number of oncologists may have increased nationwide, but still far from enough. The capacity gap between public and private systems has led many cancer patients in government hospitals to delay or forego treatment entirely. Many patients are unable to afford out-of-pocket expenses for investigations, scans, or travel. I've interviewed a patient before, not a cancer patient, but he was in Balaga, and to go to the hospital, nearest hospital, is like 400 kilometers away just for treatment. And a lot of the natives in Sarawak, they sometimes forego treatment because it's just too far for them to travel and they don't have the funds to travel. So it's a good thing that, like, I think with My Salam, they have some funds for this now, but it's still not enough. Okay, undelivered promise. That's one I think everybody knows lah, yeah. Pakatan Harapan had promised to increase healthcare spending significantly, but even after 7 years, okay, 7 years since GE 14, not much has changed. So 2018 GE 14 manifesto, Pakatan Harapan promised that they will ensure that financial allocation for the Ministry of Health will be increased to 4% of the GDP in the first term of administration. That thing didn't happen. So anyway, the following year, I decided to follow up on this promise, and I called up Chihan there. And so I asked him to calculate for me and to see like how much and track the amount that is needed progressively to achieve that amount. And Chihan said 79 billion. Okay, 79 billion. So you can see the graph there, how we are to achieve that. look at the red color line and look at the green line. The green line is the status quo, like how much we would have every year. So it would require quite a lot of funds. Okay. So that manifesto we didn't achieve, but the promise increased to 5% in 2022. GE 15 manifesto, Pakatan Harapan pledges to increase public funding spending from 2.4% to 5% of the GDP within 5 years. Okay, and the health ministry's budget for this year is 46.5 billion. Still far from the 79 billion. It should be higher now because our GDP has increased. So only a meager 1.2 billion increase from 2025 budget. This year is like one of the lowest I've seen. So it's like, is the government serious or not in keeping the promise? The spending was still at 2.4% of the GDP on public health care. Okay, the unity government has not delivered the promise until now. And last year, the health minister had asked for an additional 38 billion, but Prime Minister Anwar Ibrahim said it would breach the debt ceiling of 65% of the GDP. So you can read the article. I wrote an article about it. You can read it at your time. Okay. So between the rock and a hard place, right? More and more patients and consumers are wedged in between long waiting time at public health facilities and costly private insurance premiums and private health care. And this is especially costly for those aged 60 and above. Because it has you'll be shocked to see those once you reach 60, your insurance premiums just spike. You think that I used to think that buy insurance when you're young. They tell you, right? Buy insurance when you're young so that it won't be so expensive. Yeah, it is cheaper when you were younger, but suddenly when you turn 60, everything just double or triple. And this is causing some senior citizens to just abandon buying insurance. So you see, like a lot of products in the market, when you become senior citizens, everything becomes half price, right? But in insurance and in healthcare, it's double, triple, or many times more, especially if one has several comorbidities. So the marketization move, I'm glad that David had given a very comprehensive background to this. So we are looking at what it is like in Malaysia. Okay, the government is not increasing the promised funds for public health care. And trends are showing that there's continuous move towards marketization of healthcare services for revenue or profit. Okay, so in the early 1980s, you see the privatization policy, there's mushrooming of private hospitals, then the private wings in hospitals, such as the university hospitals and full paying patient scheme in MOH hospitals, they were created to bring in more revenue. Then now, this year, the government is going to introduce Rakan KKM, which is called an affordable premium economy services for elective treatments. Elective treatments are treatments that are not like emergency cases. They can wait a little bit. So and another thing, a lot of funds are being pushed to, I don't know whether a lot of funds, but tax incentives are given to the private sector for health tourism. And a lot of the doctors, specialists also are going into private sector for the money to go into health tourism as well. And you see the private healthcare facilities as well developed and managed by GLCs, such as the National Heart Institute, which is under the MOF Inc. And then there's KPJ Healthcare Hospitals, Johor Corporation owned, and IHH Healthcare Link Hospitals, where Kazana and has a share in it. And then you have now the Cellgate Specialist Hospitals by the Selangor PKNS. Cellgate Corporation is a subsidiary of PKNS. So you see, I find it really odd, like we're making a lot of money, but not a lot of money are going into public health care. Citizens and corporations are paying a lot of taxes. And then some of these what do you call, maybe land, this one, no? This is something that reporters can investigate. Whose land are they using for these hospitals? Even if it's under PKNS or what, it may be considered private land. But originally, what land was it? Was it a state land or was it someone else's land? I don't have the information, so it's worth investigating and also find out if it is state land to begin with, and it's you know you're building this for private care. Why? I mean, it's if it's state land and if there are public funds involved, why isn't these things benefit the public instead, the public healthcare patients? So this seems to be benefiting private care more than public healthcare patients. How are the revenues benefiting public healthcare? This is the question I think every journalist should pursue. Find out. There's a lot of investigation work here. I can't do it because I don't have the resources, but if you are working in a company full time, I think you will have enough resources to do that. And if private sector growth is supposed to bring wealth, right? That's what capitalism is all about. Where is the wealth going in? I mean, for the public sector, if you're making a lot of money, then you should put into the public healthcare as well. Unless you want to make more money from the private healthcare, so that you push some of the public healthcare patients to the private healthcare. It's a difficult dilemma also when governments are running public and private at the same time. If you're making from one side, well, who knows? The attention may skew towards one side. So we need to ask the government these questions. So, and on top of that, right, with all the private high fees that we have to pay more taxes. Not only healthcare has become more expensive, the government has decided to increase revenue to support social protection. For last year, increase and expanded the sales and services tax from July last year for some sectors, imposed sin taxes on tobacco and vape, imposed a 2% tax on big dividend earners, implemented e-voicing, carry out subsidy rationalization. There are more taxes, but where is the increase on public health care funding? I mean, when the government claims that you want to support social protection, right? So you have income tax, and then now you have SST, and then private wings, and then, Rakan KKM charges. Is this triple taxation? So I want to read this article in conclusion. I found this article through Poynter Institute. It's an institute where they train journalists and all that. You can go to their website. There are a lot of materials there which you can learn from, and even to talk about ethics and professional practices and stuff like that. So this report is from the Tampa Bay Times. After the Sky Fell by Brady Dennis. The few drivers on this dark, lonely stretch of the Suncoast Parkway in Pasco County pulled to the toll booth, hand their dollars to Lloyd Blair, and then speed away. None of them knows why the old man sits here night after night working the graveyard shift. Well, here's why. Because years ago, on a freezing winter night at a party in Queens, New York, he met a woman named Millie. Because he fell in love with her brown hair and white eyes and 100-watt smile. Because they got married, moved to Staten Island, had a son, and worked for decades in Manhattan. She as an accountant, he as a banker. Because it had been their dream to retire to Florida, and so they saved all their lives to make it possible. Because they just as they began to talk of leaving New York and heading south, she was diagnosed with breast cancer, and they spent their time and money traveling to New Jersey, San Diego, and Mexico in search of a cure. Because in the end, they came to Florida anyway, because they finally bought a house in Spring Hill, although she was too weak that day to get out of the car. because she died 9 days later on January 5th, 2002, a day the whole sky fell, he says. Because after she was gone, he found himself alone and $100,000 in debt. And so he took a job collecting tolls. The drivers who pass by see a smiling 71-year-old man with blue eyes and a gray mustache who tells each of them, "Have a great night." They don't know the rest of Lloyd Blair's story or that he keeps Millie's picture in his shirt pocket, just under his name tag, just over his heart. Okay, so with limited public healthcare funding and increasing cost of private healthcare and insurance system, insurance premiums, will this be more of the norm for us in time to come? You know, these are challenging times. Cost control measures are really, really much needed. Individuals must start working on getting their NCD readings down, and then tobacco, e-cigarette, and ultra-processed food companies must be made accountable for the health consequences. And CSOs and individuals should advocate for more affordable healthcare. That's the end. Thank you.